Hi YouTube, I'm making my 5th video here. This video has to do with my appointment that took place on July 17th, 2013 at the St. Vincent Carmel Hospital in Carmel, Indiana. I went that morning and they first called me back to do blood, urine, and test of my breath. When they took blood, they took had to be like 8 to 10 tubes. I've never seen anything like it. I guess they test your levels of everything. They also do a alcohol and tobacco test. Here's my agreement, my patient agreement that I signed back in February 22nd, 2013. So that shows, and every time you go, they do drug and alcohol test, or they alcohol test you and test you for nicotine. Just because if you are a smoker, when you have this surgery, nicotine can cause ulcers in the stomach, the small stomach that you do have, and can cause some severe problems. Not a smoker, never was, so, you know, not something I had to give up. After they did this, after they took my blood and drug tested me, they had me blow in this bag. Then I had to drink this lemon solution, which isn't bad, and I had to blow in the bag again. And it tells them if my stomach is prone to any, like, bacteria. I'm not real sure. I've just never had to do that before. But, you know, it was easy enough. And then they took me on to another part of the hospital where I was greeted by a tech, and she had me put a gown on. I had to go do a ultrasound, which was looking at the gallbladder. That was pretty fast because I don't have a gallbladder. So I went on to x-ray. They did front images of my chest, side images of my chest. Pretty simple. Take deep breaths and hold. They take the picture and you're done. After that, I was moved on to do my upper GI, which I have never had one of those. And the technician, she tells me at first, she's like, "Oh, I'm on call for the ER for surgery. If my pager goes off, I'll find you another tech and to complete your procedure here." Well, then they have you stand up on this platform. Before they lay you back, they give you the solution to drink. It's kind of chalky. It's not bad. It's tolerable, but you just suck it down because you're definitely not something you want to sit there and take your time with. So I gulped that down as quick as I could, and then they give you this little cup of Pop Rocks. And you have to swallow them. They don't want them to activate in your mouth. So you have to get this cup. It's very dry, and you have to swallow them quickly to get them in your stomach, and then they activate, and it blows your stomach up, your abdominal cavity up, blows your stomach up to, so they can see further images. Sure enough, I swallow these Pop Rocks, and this lady's pager's like, beep, 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 and she's like, "Oh, I'm so sorry, I have to go, I've got to run." And I'm like, seriously? And they tell you to hold that air in, and it's almost painful. I mean, I'm sure it wouldn't be, but I had to wait for another technician to come in. So here I am. They tell you to hold it in, not to burp. They said, everybody does because it's what it activates in your stomach. It causes you to burp. It's just natural. I don't care who you are. You're not going to hold Pop Rocks in. They give you that stuff. You are not going to be able to hold that in. Serious stuff. Good times right there. So the other technician comes in, and she laid me back on the table, which you're standing like this, and they take you for a ride, and they lay you back like this, which you almost feel like your head is going downhill, but it's not. She took a couple images, and she's like, "I'm sorry, you're going to have to eat these Pop Rocks again." This time, she mixed it in with that chalky stuff, so they were already activating. It was like a horrible Alka-Seltzer drink. So I had to suck that down real quick, get that in my stomach, and then she ran back to take more images. They literally have you do a barrel roll. You lay on your back, you lay on your side, you lay on your stomach, you roll to your other side, and then you roll to your back. That way that solution there completely coats your stomach so they can see in the pictures they take. After standing there for probably 10 minutes or so, she finally got the images. I waited there. She took them on down to make sure they were good enough to be read. And then she came back and told me I was free and clear. So I went back to my locker room, got dressed, went back out to another waiting room, and then I was called back for an EKG. Just little stickers, wires, hook you up, get a quick printout of your heart. It almost takes them longer to hook you up than it does to actually read your rhythmic beat of your heart. Very simple. The same lady then did my respiratory. They have you suck in and blow out. And you blow out, 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 out. I mean, she has you like blowing out, like you feel like there's nothing even coming out, but they have you blow out. And then they have you suck in and then blow out. So I'm sucking and blowing out on this little machine thing. And she said I have to get 3 consecutive tests that were alike for her to print for my chart. So I'm just going to town on this thing. And she's like, I feel lightheaded. I'm seeing stars. And she's like, honey, you can take a break in between breaths. Well, I didn't know that. You know, I thought she was just going to see how long I was going to go and pass out on her or something. So as soon as I did one, I took a break, did another one, took a break, did another one. I finally got my 3 consecutive tests, you know, which probably would have saved some time, but saved my lightheadedness. But that's okay. And so I did that. And then after that, I was free and clear. All this at the hospital took about 3 hours. I was there a good 3 hours. But that concludes my pre-surgery testing. Nothing too painful. I felt it went smoothly. My next appointment is going to be July 25th. That's to get my you know, my results back of my testing. And that'll be my next video. Thanks, guys.